Welcome back to Yas Nurses Spark channel. Good morning, nursing students. Today we are going to continue about the therapeutic diet part 3. In this, we are going to deal about the dietary management of obesity and DMs and cardiovascular diseases. Let's see about the cardiovascular diseases and obesity and diabetes mellitus management. Diet and specific diseases. These are therapeutic diet which are trying to manage your specific health conditions. And today we will be covering details about the dietary plans of obesity and diabetes mellitus and cardiovascular diseases, including their pathophysiology, goals, and guidelines to support the patient recovery and the health. In obesity, we will be seeing about the main pathophysiology, which is of excessive adipose tissue. We all know obesity is a excessive adipose tissue, which due to the caloric will be excessive for the patients of obesity. So we often includes with which has linked to the sedentary lifestyles and poor diet management. So we have to achieve the goal is of gradual weight loss per week. About 0.5 to 1 kg they have to loss of weight, so that the dietary management will be prescribed for the obesity patients. While prescribing this, we have to make the know about preserving the lean muscle mass too. Dietary guidelines for the obesity patients. In this, we have to reduce the caloric and increase the energy levels of the patients. For that, we do not limiting the water. They can consume unlimited of water, and also they have to avoid the sweetened beverages and fruits and mainly of coffee, tea, and alcohols. They have to avoid the fatty meals and fried food items and junk foods, so that they will not get off many adipose tissues and fatty content. And we have to use the milk and probiotics they can use, and the cheese which they consuming, that should be of low fat, and which should includes they can include of fiber rich foods for the antioxidants, and they can use cooking methods like boiling and poaching and steaming or pressure cooking without adding fats. The whatever they are consuming, they should know about, they should not add much fat to the food content. They want guidelines for obesity is continuing in this slides too. Reducing the portion of food and regularly eating, they should not skip the meals, but they have to reduces the portion of the what they are eating. Avoid the snacks and fasting between, and they can also take a calorie about per kg. They can take of 20 calories according to the weight of the patients. For the according to, they also active worker or sedentary workers, they have to change according to the patients. And protein intake, they have to get off per kg, they have to take of 1 gram. Body weight to support the, which is, or these all are maintaining to the support the muscle maintenance. These are the important aspects of in guidelines and the obesity patients. Yes, let's see about diabetic mellitus. In this, what they have, what is the main problem in pathophysiology means what is the main problem in diabetic mellitus? We all know that, which is of hyperglycemia, that is of increasing glucose level, which due to that they can get of insulin deficiency or resistance, which may affect the glucose metabolism, which may be of type 1 or type 2. In this patient, we have to maintain, the main goal is of maintaining the glucose level or postprandial and fasting. We all know the values, they have to maintain the normal range, and we should also, they have to manage the weight, so that they can prevent the complications like neuropathy. The caloric distribution is of 60 to 70 percentage of carbohydrates they can intake, and the carbohydrates daily they can get off 100 grams, so that they can avoid the ketoacidosis of, that is complication of diabetes mellitus. They can reduce the complications by intaking of only 100 grams of carbohydrates, and they have to reduce this sugar and artificial sugars. If can neither, they can add it, but they have to completely avoid the sugars, and so that they can coordinate with the insulin dosage while meal time. According to the prescribed what prescribed by the doctor, they have to take the insulin doses, so that they can maintain the normal. Using of polysaturated or monosaturated fats like sunflower oil, chickens, they have to avoid it. And high protein intake can be taken so that they can get off insulin production, boost the insulin productions, and includes of fibers, and they can take this, but they have to completely avoid the sugar content. Eat three main meals and three snacks to prevent the hypoglycemia. For reducing the hyperglycemia, the patient should not become of hypoglycemia. So we have to take them according to the patient condition. And preparing of whole grains over the rice, and they can unlimitedly eat the vegetables, and also they can include the bitter fruits and bitter gourd for the hypoglycemic effects. They can also include in their for regular routines of the diet. Now we are driving into cardiovascular diseases. In this, the main condition of pathophysiology is they may have atherosclerosis and hypertension or heart failure. According to the cardiovascular diseases, we all know many diseases are included in that. So main goals is to reduces the risk factors. They have to maintain the lipid profile and supporting the heart functions. So we have to maintain the goals. For maintaining the goals, we have to mainly maintain the lower body weight with a balanced caloric intake and activity, and eat of low fats, low saturated food items, and moderate salt and alcohol, which can be include small amount of almonds and walnuts, so that we can avoid the coconut because of high saturated fat. We have to avoid the coconut. And limiting of egg yolks, and they can take of eggs of 2 to 3 times per week. And cholesterol rich foods, they have to limit it. These are the limitations they have to avoid because of cardiovascular diseases. So they have to limit this eat low saturated foods, and avoid the high saturated foods. Mainly they have to avoid the fatty meats, which is of crabs and sodium rich seafoods. For hypertension patient, we will be avoiding of salt. So sodium rich, there are seafoods which have the more salt content. So they have to hypertension, they have to avoid the sodium rich seafoods. And they can include the fish for omega 3, which has omega 3 fatty acids, they can include. And low fat milk they can include. And also the whole food should be of boiled, steamed, and baked conditions they have to eat. They can eat the fruits and vegetables for the healthy meal. For hypertension, follow a low caloric and low fat and low sodium diet with a normal protein. And sodium restriction is compulsory. They have to 2 gram or 1 gram. Mild is a maximum. For the pregnant woman, 1000 mg is for a preferred, and avoid the salt and mg and foods, and peanut butter and processed foods, and increase potassium, calcium, and magnesium intake. So it's good for the health. That's all for today's sections on therapeutic diet. We have seen dietary guidelines for obesity and diabetic mellitus and cardiovascular diseases. We have covered therapeutic diet chapter. We covered 3 dietary strategies to manage these conditions. Let's join in the next class to explore more good nutrition topics. Stay curious and see you soon. This is Yas Nessa Spark. See you in the next video with the different topics.